The resurgence of Mpox, previously known as monkeypox, is raising global concerns, especially after the World Health Organization, WHO, issued a high-level alert last week. While the memory of COVID-19 lingers, the situation with Mpox may not be as dire, thanks to existing vaccines and treatments. However, there are new challenges to consider, particularly with the emergence of a more transmissible variant. Mpox, first identified in humans in 1970 in the Democratic Republic of Congo, DRC, has been endemic in Central and West Africa, but recent outbreaks have spread beyond these regions. The viral infection typically causes fever, headaches, rashes, and lesions, which are usually mild but can sometimes be fatal. The current surge in cases is largely concentrated in the DRC, accounting for over 96% of global cases and deaths, with the virus spreading to surrounding East African countries and even as far as Sweden and Pakistan. This outbreak is driven by Clade I, a more severe variant compared to Clade II, which was responsible for the 2022 outbreak. While the transmissibility of Clade I is still under study, the visible skin lesions it causes may aid in easier detection and screening, particularly at travel hubs like airports. Unlike Clade II, where lesions were mostly limited to the genitals, Clade I lesions appear across the body, which can help in timely identification and containment. Fortunately, there are already vaccines like Jynneos and Acom 2000 available, along with tecovirimat, an antiviral drug stockpiled since the smallpox era. Experts believe that production of tecovirimat can be ramped up quickly if needed. In countries like India, additional efforts may be needed to train healthcare workers to differentiate Mpox from other infections like chickenpox and to combat the stigma surrounding its transmission, which was linked to sexual contact in the previous outbreak. Despite these resources, the virus's potential to evolve remains a concern. Clade I has shown a higher rate of severe infections and fatalities, particularly among children, raising questions about possible non-sexual transmission. WHO data indicates that of the 548 reported deaths so far, 463 involve children. This raises fears that the virus may be mutating, making it more adaptable and dangerous. The global response must focus on containment, monitoring the virus's evolution, and ensuring that vaccines and treatments remain effective. While there is optimism that the outbreak can be managed, the unpredictable nature of viral evolution means vigilance is crucial.